Good afternoon. Thank you for joining us for today's virtual town hall meeting about coronavirus, COVID-19. I'm Dr. Kirk Tucker, Chief Clinical Officer of Adena Health System. We have our experts assembled here to provide updates on the situation in South Central Ohio, and we will be here to answer your questions about the coronavirus pandemic in general. Joining me today are Dr. Christopher Brown, Ross County's Health Commissioner, Ben Avery, Administrator for Ross County Health Department, Dr. Wael Haidar, Adena's Infectious Disease Specialist, and Kathy Edgerton, Adena Health System's Chief Operating Officer. Amy Robertson was unable to join us today, so I will be covering her section of the topic. Every day we are receiving new information, and we know people in the community have concerns. So we want to help provide you with the answers you're looking for. We have assembled our local experts, so please ask them the questions that you have on your mind and help join in the conversation. Topic number one will be with Dr. Brown from the Ross County Health Department. Dr. Brown, can you provide us with an update on where Ross County and Ohio stand in terms of coronavirus cases?
Okay. So in terms of the actual numbers for the cases, I'm actually going to defer that to Ben because he's just coming from the district. However, in terms of our words of advice during this time to help keep people safe and to keep people healthy, I want to remind people that this is more of a marathon. It's not really a sprint. So it's going to be important that you take care of yourself, both physically as well as mentally. In terms of safety, of course, right now we're trying to protect you from this coronavirus. And, I'm going to reiterate what everyone has been saying before. We still want to maintain that social distancing. Stay in if you don't have to come out. If you do come out, stay 6 feet away from people. When you are going places, use hand sanitizer or wash your hands. And it's very important for you not to touch your face. The eyes, nose, mouth, those are the way that virus enters our body for the most part. In terms of keeping yourself healthy, remember you're going to want to keep yourself both mentally healthy as well as physically healthy. Mental health, you want to make sure that you're, if you do so, you can meditate or you can pray in order to keep yourself together. Also, for a lot of families, they're going to be together for a lot longer than, they've been before. You might have the kids in there. So you'll need distractions, whether that's board games. Sometimes cooking together can provide you with a nice distraction. Might be a time to do spring cleaning just to kind of keep everybody busy. Or if you got a garden in the back, that might be a thing that you could do as well. In terms of physical health, you want to make sure that you're eating as healthy as possible. And you also want to see if you can, maybe walk. You as a family can walk together a little bit, maybe around the neighborhood if you can. So those are some of the things that I have in terms of keeping yourself healthy during this stressful time.
So I'll go ahead and fill the viewers in on the statistics. As of yesterday, the CDC is reporting 10,442 cases nationwide with 150 deaths. In Ohio, they update at 2 o'clock every day. So yesterday's data indicates that we have 119 cases in the state of Ohio with 33 hospitalizations across 24 counties. I'm happy to report that Ross currently has no cases as of this time.
Thank you, gentlemen. Ben, people rely on the health department daily for support. How has this crisis impacted the services being provided by your teams?
It is impacting health departments across the region, across the state of Ohio. We are transitioning to essential services only. As of Monday, we will be closing our lobby to the public to try, in effort to protect our employees, but also prevent the spread out into the community. But that does not mean that we are stopping services. Many of the services that you rely on the health department for are still going to be available, but that's going to be by appointment only. For example, our WIC program, Women, Infants, and Children, is still serving our clients, and they're just doing so by appointment. The individual will drive up, park in front of the building, and our nutritionists will meet the family outside, provide education as needed, and fill their WIC card for the next 3 months. So we have identified ways to continue serving people in the community.
Ben, Dr. Haidar is the next topic. the virus and who's most at risk. Dr. Haidar is an infectious disease specialist here at Adena Health System. Dr. Haidar, please give us a brief overview of coronavirus or COVID-19 and any new information related to the spread of this disease in the United States and worldwide.
Yeah, good afternoon, everyone. We spoke on Tuesday, so I'm trying not to be redundant and come up with new information. Clearly, it's very important to just remind people that this is a viral infection that goes into the lungs and causes lower respiratory infection, not upper respiratory infections, so the symptoms are a little bit different. Fevers, myalgias, muscle ache, fatigue, cough, chest pain, and shortness of breath are the hallmark of the disease. Things are changing quite fast, and there's a lot of information being poured down from all the studies and all the patients that have been infected in different locations, including in the U.S. and outside. And as this information comes, and if there's anything new, we would like to inform the public. But there's also a lot of false information on the social media and websites. So please, if I know everybody's concerned and wants to learn the right information to protect themselves and their families, but it's crucial that people look up the right information and also spread the right information, because many people see a posting and they just share it without really finding out if this information is true or not. Last time we spoke, we talked about transmission, which is still very crucial. It's a droplet virus, but a recent study from 3 days ago from the New England Journal of Medicine, which is a very highly respected medical journal, is stating that sometimes it can stay in the air a few minutes longer than we anticipated. They're saying up to 3 hours. What does that mean? That means droplets can float in the air a little bit longer, but it doesn't mean that it's the same viral load, and it doesn't mean it's as infective. So really, we don't know what to make out of this information yet. I don't want people to think it's changing from from droplet to airborne yet. But again, as new information pours in and we go through it, we'll make sure we'll notify everyone.
Thank you, Dr. Haidar. The next section was for Amy Robertson, who was here on Tuesday. She is our Director of Quality and Infection Prevention expert. Infectious diseases are with us every day, and Adena has a tremendous infection prevention team that's always working to keep patients, staff, and others in the community safe from viruses and infectious disease. They're doing a great job with this and helping us manage this new challenge. Every day, people in healthcare are reminded to protect their patients, themselves, and each others from viruses. What we are going to discuss is some of the best ways that you can protect yourselves from coronavirus. What you've, I think, already heard echoed here this morning is hand hygiene is extremely, extremely important. So the frequent washing of your hands with soap and water or alcohol-based sanitation products for approximately 20 seconds. So think of that as singing happy birthday twice while you wash your hands under your sink. Especially after touching anything that's frequently used, like a doorknob or a railing going up and down a stairway, or say the gas handle at the gas pumping station. Stay home when you are sick. So if you have any of these symptoms, a low-grade fever, a cough, shortness of breath, congestion, keep yourself at home. Don't go out and risk infecting others in the public. Disinfect frequently used surfaces such as mobile phones, again, doorknobs, phone handles, railings. Cover your sneeze or cough with a tissue or inside of your elbow when you sneeze. Avoid touching your face and shaking hands. Shaking hands has rapidly become sort of a social no-no. Avoid or limit discretionary travel. So limit shopping trips and social visits and practice social distancing, trying to keep at least 6 feet away from folks. Send out one person to do the shopping. Don't go out in groups or in families. Be very focused about your shopping. Have your list in hand. Go at off hours. Wash the surfaces in your hands when you come into the grocery store. And then on your way out, before you get back into your car, wash your hands again. or use hand sanitizer. And then call your physician or personal health care provider before coming in for appointments. This allows us to plan for your visit and also to potentially screen for symptomatic patients. We at the health system are redirecting those who have respiratory tract infectious symptoms to the COVID clinic here on campus in order to try to have a singular process to meet those patients' health care needs. A brief section here Amy wanted to relay on testing and data. As of yesterday, the Ohio Department of Health advised public health officials that testing the masses in order to screen for this disease is just simply not feasible anymore. There is a limitation on the amount of supplies. That includes the viral swab kits that are used to test the individual patient, and then the testing kit reagents themselves, which are located at the lab, are starting to run short. They have redirected health systems to focus their testing on those that are hospitalized and severely ill, and that is to help make clinical decisions on their treatment and triage, and also to be used in healthcare providers that fall ill in order to rapidly identify those that are infected and allow the non-infected to return possibly to duty. There are no positive tests confirmed here at Adena Health System as of yet, and as Ben said, in Ross County, we have tested 6 inpatients to date. One of those is still pending. All of the other 5 were negative. We currently have 1 patient in the ICU that is awaiting their test results. Next topic will be Kathy Edrington, the Health System's Chief Operating Officer. Kathy, Adena Health System covers a 9-county service area of South Central and Southern Ohio and is responsible for the health of almost 500,000 people. A lot of work has been going on to make sure Adena is doing everything it can to limit exposure for our patients and staff throughout this crisis. What should our patients and communities know about these changes?
Good afternoon. The health, safety, and well-being of our patients, our community, our physicians, our advanced practice providers, it is of the utmost importance. And so we want patients to know that they can still come to the health system for doctor's visits at this point. It is likely that that will change in coming days, but right now we are doing screening at all of our doors. That entails both questions that you would get asked around your travel and folks that maybe you have been around that have tested positive for COVID-19, as well as having your temperature screened to ensure that it's safe for you to come in to the buildings. We are also doing that with our employees to keep them safe. One thing that Adena is really focused on is telehealth and making sure that we can provide visits to our patients through telephone and through televisual. Phase 1 of that will go live March 23rd, and those will be telephone visits with our AMG providers. Phase 2 will be televisual visits, which would go live March the 30th, tentatively, and that will be our behavioral health, wound care, dermatology, pulmonology, cardiology, vascular, and surgery. So that is one of the things that we're really trying to do to prevent people from having to come in and be exposed. Following the governor's order, elective surgeries and procedures have been postponed indefinitely, and that is mostly because we have got to preserve our personal protective equipment for our caregivers. In addition, we've made a lot of operational changes over the last week. In our cafeterias, we have gotten rid of our dining spaces where we can follow social distancing, as well as not having self-serve salad bars and such. Lots of prepackaged foods. Valet parking has been eliminated, and that is really just for the safety of our patients. We have put in place remote working from home for many of our caregivers that are not at the front line of clinical care, and that has allowed for us to prioritize the parking for our patients since we've had to close that valet. One thing that we really want everyone to know is that if you are sick and showing symptoms of COVID-19, we opened a triage hotline. That hotline is 740-542-SAFE, S-A-F-E, where you can talk to someone about symptoms you're having. Based on the call, the clinician may recommend the call come to the COVID-19 Screening Center, which is located on our Chillicothe campus in our Health and Wellness building. Want to remember that our urgent cares and our EDs are still open. And if you have an urgent care or emergency department need, you can still come to our center or any of our locations. You will get screened in the front of those areas as well, and you may be sent to the COVID-19 screening center if you screen positive for travel and or have a fever. The reason that we're doing this is because we want to try to filter patients to the same place. We're trying to minimize the exposure of patients who might be infected with our healthier patients and with our caregivers. This may change. All of this is subject to change. That's one thing that we know in healthcare, that you got to be nimble, and we've had to make a lot of changes in the last several days.
Thank you, Kathy. I know some of which you might be thinking, is the health system prepared, and how are they preparing for even the worst case scenario? I think that would be a very anxiety-provoking thought for me as a member living in the community. Some of what I'm going to share with you today, I'm going to reveal some of the details of just how robust the planning and preparedness is. We have, with the help of our lab, reached out and received plenty of test kits and swab media to be running multiple tests, even for flu and viral respiratory panels, so that we stand ready to follow the state-directed guidelines for testing. If you're sick enough to be admitted here to Adena for something that looks like COVID-19, we will be able to test you. Personal protective equipment, you listening to the news and hearing the anxieties of health systems nationwide, worried about running out of equipment like masks, gloves, and gowns. We have very aggressively and early on sought to reach out to secure our inventory. As of right now, the most critical masks the health system has on site, 7,000 of these available for the next week or so that we can utilize, and have reached out and feel confident that we've secured 30,000 more. So our efforts are paying off in that regard. Equipment, the health system is rapidly looking into what our capacity will be to provide ventilator support to those patients that should fall ill and require intubation and ventilation. We also, as of today, began assembling lists of all providers capable of managing ventilated patients, so that we will know exactly what our capacity will be and can plan for that. And I can assure you that the health system stands very strongly placed when compared to other health systems in our abilities to care for the critically ill. We have already begun to open a cohorted unit. That is one nursing unit dedicated entirely to the care of patients that might present to us infected with this condition. That will hold in the first unit 20 beds with dedicated physician, respiratory therapist, 1-to-4 nursing ratio. All the nurses on that unit will be able to use specialized equipment to prevent infection transmission in themselves. We are prepared to open up 2 more units as of today, should that need present itself, and are even looking at our backup plans for developing other areas of the hospital and dedicating those to the care of the affected patients. We are preparing for what some estimates are suggesting 25% of our healthcare workers could fall ill. So we are preparing backup and contingency plans for registered nurses, therapists, healthcare providers, physicians, surgeons, etc. Those lists are rapidly being gathered. Some of what we're doing here in the calm before the storm is having folks sit back and being on call, but being in wait to be called into duty. If we reach peak activity and the health care system is challenged to the maximum to meet the demands of the community, we'll need to have people on the clock 16, 20 hours a day with periods to rest in between, change clothing, and then come back to duty. We are implementing strict access control all across the healthcare system. We are watching what's happening in Seattle and New York, and anticipate at some point the possibility of having to completely limit access to the healthcare system. We can assure you we're keeping in mind that for those patients that might be at end of life or dying or critically ill, if we anticipate a bad outcome, still allowing those family members to be able to visit with their loved one. We are also planning for contingencies beyond the technical floor space capacity of the health system, looking into other areas of the health system, such as this building itself, and whether or not it can house care units such as nursing wards to care for overflow. The health system has also already reached out to local area hotels as a potential backup location for the non-infected, non-critically ill patients to potentially go to receive further low acuity treatment and convalesce. So our preparedness is, I think, very broad thinking, and we're trying to leave no stone unturned. At this point, we have some of the questions beginning to pile up. I will read those and then kind of delegate them out. I want everyone here to feel comfortable going ahead and speaking to it if you feel like there's something you can address. First question is, if a patient presents with virus symptoms, are they tested and told to isolate themselves? Dr. Hyder, you'd probably be good.
So the question is, if somebody has a viral, again, it depends if it's upper respiratory or lower respiratory. Either way, we're clearly still testing and treating all our patients, whatever their needs are. So if somebody comes in with symptoms that are concerning for COVID-19, what we're doing is, yes, we're testing them for the flu. We're testing them we have something called a respiratory infectious panel that tests for other viruses like rhinovirus, human metapneumovirus, etc. And all these viruses are ruled out. And if we still have a high index of suspicion, we are, and the patient requires the proper test, or they're clinically very ill, require hospital stay, they might qualify for the COVID-19 testing, and yes, we are testing for that. A lot of things look similar in medicine, so sometimes you have a bacterial infection that looks similar, and we test for strep pneumo sometimes, and if that is, or group A strep, and if that is positive, clearly we give them the appropriate antibiotics as well.
Understanding that, again, between testing supplies and then the reagents at the lab are in limited quantities around the state. Again, the state has directed us to test the sicker patients, and again focus on healthcare workers that need return to work. You need to rule out this infection before you can place them back into the care of patients. So when you show up after calling to the COVID clinic or even to an urgent care, if you are not having any severe symptoms, it's very likely that unless you've been exposed to somebody that has a known positive test result or had some other high-risk travel history, the state is not directing us to screen the general population anymore for symptoms. So that might change day by day or week by week as more of these supplies become available, but at this point in time, no, there is limited testing being performed on those that are highest risk. The next question is, do you have the ability or resources to set up drive-through screenings?
Yes, we do. Yes, we do. In our screening clinic, we do have that ability, but to Dr. Tucker's point, I think people need to understand the difference between screening and testing. So yes, we have the ability to do that, and we've been evaluating that daily on the need based on what we're seeing in our screening clinic and what we're seeing on our triage hotline.
Absolutely. I think some folks are watching the news around the state and seeing large health systems set up parking lots of universities for drive-through screening and testing. Again, this is, generally speaking, not always where everyone driving through is getting their nose or throat swabbed and being tested for COVID-19. The state has been very clear in their directive of who should receive testing for this. The danger in pulling off or trying to execute such a strategy of that is already coming to realization in some communities around the country. If you look at testing centers which have opened and then within a few days had to close down because they ran out of testing supplies and equipment due to indiscriminate use. We're trying not to do that, so much so that I have sequestered some of the test kits for COVID-19 and the respiratory infection panel and dedicated their use only to inpatients, so that if you present here sick enough to be admitted, we have the ability to test you. Next question, as you look forward to... go ahead, Chris.
Because I'm sure that there'll probably be some more questions there, but I keep seeing an emphasis on the testing. And, I want to remind people that, we like to test. It would be nice if we had a lot more tests, but the treatment, we don't have a treatment for this virus. So those individuals that have mild symptoms, we're asking you to really kind of to self-isolate anyway. I know everyone wants, like I said, want to drive through testing or wants to get tested. But if you feel ill, stay away from others, self-isolate, because we really don't have a treatment for this anyway. Now, of course, if your symptoms get worse, especially with the shortness of breath, you definitely want to call your clinician to get the screening, to come in and to, if asked to do so, and to get evaluated. But the testing, because I just see even on social media a lot of people focusing on that. But we want to remind people that if you, like I said, if you're at home, you have a fever, like I said, we still want you to self-isolate in those cases.
Thank you, Dr. Brown. Next question is a good one. As you look forward to prepare, are you talking about weeks or months?
I would answer that one. So we actually have models that we're using in our area based on our population, Dr. Tucker, and we've mentioned approximately 9 counties that we cover. So based on our population and the models, how it's been worldwide in the U.S. and in Ohio, we think this might take a few weeks. This is all predictions, but these models seem to be accurate. Probably 12 weeks is what we're looking at. But again, this is nothing concrete, but this is where I think we're going to be in that ballpark.
Yeah, so the models that are coming out of places that have had the outbreak, have reached their peak, and then have begun their recovery phase, generally indicate about a 90-day period of events. From onset, where the curve of those infected begins to make a rapid upward incline to where it peaks, and then levels off and then begins to fall again. Looking at the curves as it presented in South Korea and China, I think are very informative. Again, how high that curve gets is dependent upon how the community responds to the quarantine and self-isolation, social distancing orders. That curve is a lot more narrow and peaks higher in those communities that don't heed the warnings. I think if you want a model of that, what's happening in Italy right now is a perfect example of a society that did not heed the warnings of isolation quickly enough and is now in dire trouble. Evidence to reinforce that is the fact that Italy has already sustained about 400 more deaths in the country than in all of China, whose population is 20 times as large as that of Italy, indicating to me that they were very behind in their response to what needed to be done.
I think one last thing that I would add there in terms of the timing, our social isolation measures that we are incorporating now could actually extend the time period that we're looking at here. So if we're doing a good job, it might take a little bit longer because, again, distributing those patients over time is what we're trying to accomplish.
And what Ben is referencing there is when people follow the good public health directives, the curve gets less high, but then the time period at which you're tackling it spreads out longer. The principal purpose here is whatever you can do so as to not overwhelm the local healthcare system and the resources it has. So very important principle. I like this question. For treatment at home, are the over-the-counter medications that are available to treat flu or influenza effective for COVID-19? Dr. Haidar.
So to treat the flu or the viral infection, there's 2 things that we need to look at. Number 1, there's symptomatic relief. So, and I would like to make a comment about that. We usually use acetaminophen for fever and NSAIDs like ibuprofen or whatnot. There's a lot of postings online that says, you can't use NSAIDs and it has detrimental effect on patients with COVID-19. That actually was said by the Minister of Health in France. But the more the NIH and the CDC has reviewed multiple literature, and we don't have evidence yet that we can't use NSAIDs with COVID-19. So I would like people to know that if you don't have Tylenol or acetaminophen at home and you only have Motrin or ibuprofen, there's no literature that is strong enough to say we can't use ibuprofen. As for the other medication that treats the flu itself, the antiviral medication like Tamiflu or Xofluza or any of the other ones, no, they do not work for the coronavirus. But there are a lot of experimental medication that people have been looking at. One of it is called Kaletra, which is actually part of the medication we use for HIV, which is a combination of lopinavir and ritonavir, and that multiple studies showing that it's not as effective, and most people are steering away from it. There's actually a medication that we've used for a long time for malaria called hydroquinone. There's a Plaquenil is the name, the commercial name, and that seems to show very promising results. And the Adena is looking into studies and see if we can get some stockpiles as a backup or in severely ill patients. Multiple studies from France and even from Seattle is showing the Plaquenil plus azithromycin might show promising effect, and we're looking very seriously into that as well. There's another medication called Demsivir that has been used previously for Ebola patients that also shows some effect, but it's hard to get that medication right now. It's not generally available in the U.S. other than through compassionate plea from the CDC. I guess that's how you have to order it. But again, Plaquenil plus azithromycin is showing promises, but that's also only preserved for severely ill patients. Anyways, to answer your question, no to the Tamiflu and the Xofluza, and Motrin can be used if just like Tylenol for symptomatic relief at this point.
Thank you, Dr. Haidar. That was the next question of, it hasn't been confirmed that ibuprofen or Motrin worsens the symptoms. And again, at that point, I would agree with him from what I've read as well, is that was only speculation and there's no objective evidence that that's actually the case. So I would certainly, if I had flu-like symptoms, headache, fevers and chills, and wasn't feeling well, Tylenol's a great first go-to, or acetaminophen. And if all you have is Motrin or ibuprofen at home, that's a great backup. For those who require COVID testing, what is the turnaround time for results? Dr. Haidar has already gotten a lot of experience with this.
Well, so we actually have multiple channels to get the testing. We can go through the ODH, we can go through private labs, and each one has a different turnaround time. The ODH has been good in getting us the results back between 24 to 48 hours, which is pretty good compared to other states. I have communicated with multiple other colleagues in other states, and some actually take longer. So that's a good thing. We also work with private labs, and the turnaround time, including transport and everything, is 3 to 4 days. Of course, every lab is working 24/7, so that includes weekend, weekdays, any time of the week, I guess. So 24 to 48 hours if we go through the ODH. If we go through a private lab, it takes a little bit longer, maybe 3 to 4 days.
I would echo that, again, realizing that the Ohio Department of Health has very strict criteria for which tests they will process. So if what we've done here is, if we have patients that we suspect have it and the Department of Health in Columbus says that they won't run the test, we're sending then those swabs to LabCorp, and they've graciously agreed to help us to test patients. Turnaround time, would echo probably yes, around that 4, even 5 day period is what I've seen somewhere else around the country. Next question, does anyone in Ross County have COVID-19? At this point, Ben?
No one at this time has been confirmed to have COVID-19 in Ross County. I think it's obvious that the hospital has prepared very well for this situation, but our community is also preparing. We have, per the commissioner's order, have recently assembled our Emergency Operations Center in Ross County. So that's bringing together all the people that would have any role in an emergency response to discuss what the next steps are here locally. So we're meeting on a daily basis. We're getting unified messages out there, and we're doing unified planning. And I think even though community members aren't in those meetings, you would be really very proud of the progress that we have made and the readiness of the community. Two things I wanted to mention really quick on the community level. We recently revamped the 211 call-in number. So this is a resource referral line that you can use. If you're a community member and you have any need whatsoever, you can call 211. And we know that this pandemic is having social implications locally. It's having economic effects. So I would encourage anybody that's running into a resource need to really reach out and use that 211 call number. One last thing, I have to get a plug in for our Medical Reserve Corps. The Ross County Health District is assembling a group of volunteers that can help in this response to the coronavirus. So on April 25th, we were going to be holding a virtual meeting to talk to people, both medical and non-medical, about how you can sign up to be a part of this volunteer group. I also know that the United Way of Ross County is also seeking volunteers. So if you want to help in this situation, I'd encourage attending that Medical Reserve Corps meeting sponsored by the Health District, or also reach out to your local United Way.
Thank you, Ben. I have another question. I have a sore throat with white patches. Should I be concerned and checked out? So being the resident primary care physician here, I'm going to field that first. As Dr. Haidar echoed earlier, generally speaking, COVID-19 or coronavirus is not presenting with upper respiratory symptoms. What we mean by that upper respiratory symptoms is really from the throat up, and that would include a sore throat or laryngitis, nasal congestion, runny nose, or affected eyes. So the white patches in the sore throat do not suggest COVID-19. However, it could suggest strep throat. So at this point in time, I would recommend a visit with a healthcare provider, principally to see whether or not rapid strep testing and antibiotics would be necessary. Anything else, Dr. Haidar? All right, thank you. I passed the test. Are the measures the U.S. is taking more similar to China or Italy? I love this question. Ben, you want to handle this one?
I'm not an expert on the measures that have been incorporated in both those countries, but we did see very steep peaks in the onset of illness in both countries. Our governor at the state level is really setting the tone for the nation at this point in terms of encouraging the social isolation that's going to be required to slow the spread of this virus and flatten the curve. So I feel like, at least in the state of Ohio, which is what I can speak to, that we were out in front of the nation in terms of our response to this outbreak.
I would agree with Ben. What's happening in the United States is we're sort of acting like 50 independent nations. And some of those nations are acting very responsibly, and some of them are not. And at this point, there will be dire consequences for the ones that haven't responded quick enough. I would commend the quick action and the authority exercised by the governor of the state of Ohio, Mr. DeWine. I'm hoping that for us, then, this means that we will see a less severe curve and fewer deaths related to this infection. How can I be sure my loved one in a nursing home facility is safe? So, any of you want to tackle that one, Dr. Brown?
In terms of your loved one in a nursing home, because of course you're not allowed to visit nursing homes at this time. However, you can still call. You can still call your loved one. You can talk to the nurse who is covering, I would imagine. And I would think that those would be ways that you can keep in contact with that person to make sure they're doing quite well. As a matter of fact, that during this time, since they can't take physical visitation, I think that making those calls or seeing if the nursing home can make it available that you could maybe do a actual virtual visit, like either Skype or maybe FaceTime, would actually be beneficial for those individuals that are in that lockdown situation.
Absolutely, and that's actually something that we're doing at all of our Adena sites with the changes in the visitation. As we've put iPads on the units so that with the changes in visitation, we can still do visits via FaceTime.
Yeah, I think the advice for keeping folks safe in nursing homes is similar to other agencies and businesses. You know, we need to be taking the temperature of every employee that comes into our buildings, recording that, and you know, we also need to limit the flow of public into these buildings as best we can, and I know that is happening through executive order here in Ohio for nursing homes.
Thank you. Is it safe to go outdoors if we are in quarantine or during a lockdown? Dr. Brown.
Yes, it is safe for you to go outdoors. As a matter of fact, it may be encouraged. We're not forcing you to stay inside the house. We are forcing you to socially distance yourself from other people, so you shouldn't be jogging in a group or anything of that nature. However, if you want to walk around your neighborhood or even if you go to a park, as long as there's not a group, you can still do that as well. So you're still safe to do that.
I would agree. There continues to be some confusion if coronavirus is airborne or not. Can you explain this further? Dr. Haidar.
I kind of mentioned it a little bit earlier. The answer is we really, last time I was adamant that it was a droplet, but now more and more information is coming in saying it probably is suspended in the air a little bit longer. There's a study that I quoted from the New England Journal of Medicine from the 17th of this month, which is only 3 days old, that is saying that the particles can be up in the air for about 3 hours. But again, just the virus being in the air doesn't mean it's still as virulent, or is it in a high enough quantity to be a cause of concern. Again, the answer is we don't know. In the hospital setting, we're treating it with airborne isolation and contact isolation and face shield. But the final results are not in. So we think it's droplet, but we're not 100% sure.
So if I were you, I think the best way to understand this is, I believe you can find this on YouTube. If you can watch what's called a sneeze cloud after somebody sneezes or coughs, and then you can watch that cloud and what it does over seconds to minutes. The idea with this virus is when you see that sneeze cloud, those are all sort of droplets floating in the air of saliva and whatnot, which are highly infective. So if you're in a store and somebody sneezes and then creates a sneeze cloud, like again you can see on the internet, and then you were to walk through that and inhale those droplets, that is what is imminently infectious. Part of, I think earlier this week we were talking about those droplets and how long they remain suspended in the air before they're pulled by gravity, eventually all to the ground where they're less infectious. That's part of the question they're trying to understand right now. But I think the best way to demonstrate that is to look at it yourself.
Yeah, and if again, there's also it's not black and white. There's a lot of gray. It also depends on the humidity in the air, because the virus will attach to the water droplets in the air, and then it will be heavier. It will fall faster. So really, it depends on multiple factors: the temperature, the humidity, the maybe barometric pressure, and everything else. So the answer is not black and white. And maybe they should watch the YouTube video that Dr. Tucker talked about, but make sure you watch it in restricted mode, because there might be other videos. No, I'm just kidding. I don't know. But yeah.
Love it. Love a little humor. It's keeping us sane. If people in our area strongly adhere to suggested physical distancing, how positive do you feel that this would impact our area spread? Has that been built into your recent models or predictions? So the answer to that is absolutely yes. If people in our area adhere very strictly to what the directives are from the governor, and again, to emphasize those, that only go out if you have to. This includes children out and playing with one another in anything larger than smaller groups. One person going to the store when absolutely necessary. One person going to the bank. Practicing strict hand hygiene. 6-foot social distancing. We know for a fact that this will affect the curve of severity that we will experience here locally. The data processing team that I've got here on quality and infection prevention has presented me with sort of 2 scenarios in which, yes, we adjust the spread of whether or not this virus affects 40% of the local community all the way up to 60% of the local community, and what kind of a demand that would place on the health system as far as peak requirements of care. And it does, as a matter of fact, affect whether or not we anticipate being potentially overwhelmed with care. So again, that's an emphasis on everybody adhering to these public health guidelines and adhering to them. Ben, anything else you want to add to that?
No. Nope.
Thank you. All right, are there any last thoughts amongst the group that they would like to emphasize before we wrap up? If not, I will
Like
go
to
ahead.
say
Sure.
something. So, not because I work here, but I think Adena and the administration is doing a great job. They're all working hard and getting the up-to-date information, trying to keep everyone safe. But needless to say, this is a team effort. That means the community has to do its part for us to do well and for the patients to do well. I really, just because we're being over-prepared and we're doing everything we can, I still think the community needs to get together and make sure follow the guidelines to the T. That would make everybody's life easier and will keep everyone safer.
Thank you, Dr. Haidar. Appreciate that.
In terms of the need for the community to come together, whether it's Ross County, state of Ohio, and the U.S., I think you yet again with these public health measures, you really affect the curve, and if you don't practice them, we may be in a situation where we're like, what they had to do in California, and it sounds like what they're about to do in New York, where the governor will be forced to put in an order where we're all stay at home. And then that is a lot more restrictive than what we have right now. Right now, everything's voluntary. However, once they put these orders in, it becomes more and more forced upon you. But if we can all cooperate together, that can minimize the chance that we would have that more stricter rules will be applied to us.
Just one last thing that I'd like to add. We need to keep in mind why we are doing all this. It is to protect those most vulnerable populations in our community. Those folks that are elderly or immunocompromised, those are the ones that are going to be most affected by the coronavirus. So if you're taking care of an elderly person, you need to think about what exposures that you're comfortable with in coming home to take care of that individual. So again, let's just make sure we're focusing on those elderly individuals and the vulnerable populations.
All right. Thank you, team. I wanted to reiterate one more time the hotline number. That's for folks who have symptoms or potentially exposure and have questions you want to answer. That is 740-542-SAFE. 740-542-SAFE, S-A-F-E. I would like to extend thanks to our panel today. You guys have given us great information, and it's been very helpful and appreciated. I would like to also thank all of the viewers that have participated and watched today. Please share this on Facebook and in any way that you can to spread this information out to the greatest number of people, again, hopefully for the public good. It's important to us that you stay healthy and have good understanding of the situation and how your local health partners are adapting in this rapidly changing environment. To stay up to date with reliable information about coronavirus, we urge you to visit adena.org/COVID-19. adena.org/COVID-19. There you will be able to find links to the Ross County Health Department, the Ohio Department of Health, and the CDC. Again, we'd like to thank you for participating in today's discussion and urge you to stay safe. Thank you so much.